Hi, my name is Mandeep Sran. I am an emergency physician in Calgary, and I also serve as one of the board of directors for Punjabi Community Health Services. I was asked by one of my colleagues to answer a few questions regarding the COVID-19 pandemic. First question: how can patients access emergency or other care during COVID-19 situation? I would say the best way to access care during the pandemic is by calling your family doctor. Most physicians are handling majority of their patients' concerns over the phone. They will either direct you to come to the clinic or head to the emergency department, depending on your symptoms. I would say having an open means of communication with your family doctor is your best bet. Second question: if a person has general influenza like symptoms and they are getting worse, what should he or she do to get access? Right now, the best approach is for Albertans to access the self assessment tool available at www.myhealth.alberta.ca. This will outline your response, whether you should call 811 versus calling EMS or heading to your nearest emergency department. Third question: if a patient has COVID-19 and is in quarantine for 14 days, and after 14 days, could he or she start living a healthy life? There are a few different situations here. If you've had influenza-like symptoms, you are legally required to isolate for a minimum of 10 days if you have a cough, fever, shortness of breath, runny nose, or sore throat that is not related to a pre-existing illness or health condition. The mandatory isolation period is 10 days from the start of symptoms or until symptoms resolve, whichever takes longer. Secondly, if you are tested positive for COVID-19, you are legally required to isolate for a minimum of 10 days if you are tested positive for COVID-19. Isolation period is for 10 days from the start of symptoms or until symptoms resolve, whichever takes longer. We will be attaching the self-isolation information sheets in English, Punjabi, Hindi, and Urdu in the link below. Fourth question: if a COVID-19 patient who recovered from coronavirus, can they get reinfected with COVID-19 again? The immune response, including the duration of immunity to COVID-19 infection, is not yet understood. Patients with a similar infection in MERS are unlikely to be reinfected shortly after they recover, but it is not yet known whether similar immune protection will be observed for patients with COVID-19. I would say if someone's been exposed once to COVID-19, I would use precautions to minimize the chances of getting reinfected. And the last question: can I provide any suggestions or tips on how to do self-care during COVID-19? The pandemic can feel overwhelming due to constantly changing and new information, long work hours, and caring for your family and yourself. It's important to pause for a moment and collect your thoughts, as worldwide pandemics can be taxing. Remaining calm can help. Here's a few tips on taking care of your mental and physical health. In terms of your mental health, set and maintain a routine at home. Focus on things you can control. Use technology to maintain social connections with your loved ones. Consider a regular check-in schedule to give yourself something to look forward to. Listen to music or read books. Consume reliable news sources that report facts and avoid media that sensationalizes emotions. Lean on your personal beliefs and faith for support. Acknowledge and appreciate what others are doing to help you and your community. And lastly, look for ways to help your community, such as blood donations, checking on older people in your neighborhood, and donating supplies or money to local organizations. In terms of your physical health, again, create a routine. Fuel your body by eating a healthy, well-balanced diet and drinking plenty of water. Exercise 3 to 4 times per week. Aim to get at least 7 to 8 hours of sleep each night. And spend time outside, such as going for a walk in the park, but follow social distancing guidelines. And you should watch for any of the signs for depression and anxiety, such as trouble focusing on daily activities of living, anxieties that turn into feelings of being out of control, strong feelings that interfere with your daily activities, and having emotions that become difficult to manage. If you are starting to feel these symptoms, please seek professional help through your family physician or reach out to us at PCHS. We're here to help. I hope this was helpful, and everybody, please be safe.